We're talking about weight loss medications, GLP-1 agonists like Ozempic, Mounjaro, Wegovy, semaglutide, and your thyroid disorder. So I promised you guys this. I'm delivering. We're gonna go deep, so I hope you're ready. I'm Nicole McPherson. I'm a PA. I'm a thyroid expert by way of being a patient, and I'm the founder of Modern Thyroid Clinic. My day job is to give people with complex thyroid disorders their lives back. So I have a ton of experience with this class of medication, and obviously my baseline everyday job is people with thyroid disorders. And let me tell you a little bit about my patient population. Largely, they are women who in general put effort into their lifestyle. A lot of them eat perfectly. They exercise more than I could ask them to. They eat in a very clean, low inflammatory way. So guess what I'm not gonna do? I'm not going to actually go to them and say, so I want to take away this. I want to reduce your calories more. I want you to exercise more. No, because ultimately with hypothyroidism, calories in does not equal your outcome. It is not a mathematical equation with these people. They have lost their metabolic potency. So they have to over restrict to ridiculously unreasonable amounts in order to lose weight much of the time. I don't want to say that's everyone, of course not. I don't want to generalize, but this is a huge, huge problem in the thyroid community, and it is very difficult and time consuming to unravel that metabolic damage. Well, let me tell you that GLP-1 agonists have a unique ability to solve this problem because, of course, yes, they allow you to lose weight. So if someone is sitting 15 or 20 pounds over where they feel most comfortable and they basically have to quasi have an eating disorder to try to reduce their weight, which I am never an advocate for, GLP-1 agonists can help to reduce their weight over time and get them to their more optimal weight. Yes, and let me tell you, that is amazing. It is life-changing, but it also goes so much deeper than that, y'all. So the other things that these medications do while they are working on helping someone reset their baseline weight is they improve your core metabolic function. So I'm talking specifically about people with thyroid disorders. Even if I perfect their thyroid medication, their hormones, put their hashimotos into remission, there's still a lot of unraveling of this damage that can take years to resensitize their metabolism and make it respond appropriately. What GLP-1 agonists do is they take that year's time frame and they consolidate it into weeks and months. And they do that because they resensitize your blood sugar metabolism, which is a foundational piece of how well your metabolism will work or not work. And so what that means is while you are losing weight, your metabolism is healing, so that when my patients come off of these medications, and they do, their metabolism is better than it was before they went on them. And that allows them to maintain their weight, sometimes even lose additional weight without getting to disordered eating levels. So that's a huge, huge, and absolutely incredible improvement. But there's more. The other things that I'm seeing, one that I wasn't expecting, is a massive amount of food freedom with these women. These women that have been controlling themselves and living in this tiny little box, trying to mitigate every risk that's going to make them gain 4 pounds over the weekend that's going to take them 2 years to lose. No, this medication solves that. It gives them a little bit more food flexibility while still improving their metabolic function over time. But the cool thing is at Modern Thyroid Clinic, we collect data on these people before they start our weight loss program and every 3 months throughout. And so not only are these people losing weight, improving their metabolism, creating more food freedom, and becoming more free from disordered eating, they are improving their long-term health markers, y'all. Specifically, my very favorite, most enormous thing that I see with this is a measure of something called your CRP, your HSCRP. It is an inflammatory marker, but it's also used to risk stratify the likelihood. Sorry, someone called. They can risk stratify your likelihood of having a cardiovascular event like a heart attack or a stroke in the future. Well, what I am seeing over and over and over again in these women and men in general, but I mostly see women, is they can go from extreme risk for heart attack and stroke down to the lowest possible number. This is an objective marker. Your risk stratified in low, average, high. And I'm seeing women go from extremely high, like a high is above 3, and they'll go from 35 to less than 0.3, which is low, is less than 1 in 3 months, you guys. So just huge impacts immediately, of course, on people's mental and physical health, but also on their long-term health outcomes. So anyway, I wanted to share that with you guys. It's a conversation that I have on TikTok Lives. Comment your questions about this topic. Share it with a friend, like, save, follow.